No one's treatment requires visits to 6 different offices, which is what had been stated earlier. Initially, diagnostic studies may require more than one office, with the distance in our case being a driveway. A building by its mere presence does not make a team of physicians. All of these physicians are individual practices. Putting them in one building does not change that fact or create a team, nor does it remove them from their present practice buildings. Cooperation and communication make a team, and that is independent of its location. Now, many universities are diversifying their specialties location in order to reduce patient stress by providing a less overwhelming environment. Otherwise, patients begin to feel like numbers, not whole people. The University of Florida now uses 5 separate facilities in Gainesville alone that are not contiguous in location, but rather are spread out from one another to accomplish this goal. At the Robert Boissneau Oncology Institute, equipment includes 2 Varian linear accelerators, one of which, as I stated, is $2.5 million rapid arc. I know that to be the fact because I wrote the check. These are maintained by 2 of the finest in-house former Varian engineers. They are having full-time presence and they are readily available for any maintenance on that equipment. Our quality control is second to none. Professional staff includes 7 radiation oncologists, 3 of whom actively serve residents on a daily basis in the village's facility. Our 7 radiation oncologists, who are all available to review your treatment design and plan, represent greater than 100 years of treatment professional experience. And every morning when I get up and look in the mirror, I realize that I am probably responsible for the majority of that 100 years. We have 15 physics staff members, 3 of whom are PhD physicists with 8 medical dosimetrists. That total represents more than 130 years of professional experience. We require redundancy in our treatment delivery. 1 therapeutic technologist is required by state law to deliver the care. But the Robert Boissneau Oncology Institute requires a minimum of 2, and almost always 3, technologists to double and triple check for accuracy with each and every treatment that's given. Our physics staff literally hovers during the entire process, carefully reviewing every detail of treatment administration and design. For those of you who know us, you know that 20% of the patients we treat have no money, and we write those charges off completely. I do not have a collection service. I do not believe in collection services, and we will never have one. And in the 26 years that I have been in private practice, we have never, ever refused a patient because they cannot pay. Our accreditation is the same as the Moffitt, and that is the American College of Radiology. Our affiliations may be somewhat different in that we already have an affiliation with Mayo Clinic, and this will include virtual conferencing with the anticipated ultimate physical presence of Mayo Clinic representatives here. We are already affiliated with the Moffitt, and virtual conferencing could certainly be expanded with them. We are not limited to one institution, but we have the flexibility to refer to any tertiary care center. These decisions will always be made with the inclusion of your primary care physician involved in that decision. Let me give you an example. If you were to come in with a cancer that started in the bone or started in the muscle, I'm not talking about a cancer that spreads to that area. I'm talking about one that starts in those structures. I would refer you to the University of Florida because they are truly the experts in dealing with orthopedic oncology. We are going to select, with your primary care physician, recommendations for you to go to the best institution for that decision. What about the agreement with Moffitt as to equipment with comparable equipment 1,000 yards away? Well, let me talk to you about a little conversation I had with Dr. Craig Stevens. He and I have been friends for years. I went down several months ago to Tampa and had dinner with both he and the chairman of the Department of Neurosurgery, Dr. Stephen Brem, with the intent of designing better care programs for all of our patients. And we discussed the type of equipments that I have in my practice. I was somewhat surprised to find out that when Moffitt was announced in the newspaper and that radiation oncology would be furnished by them, that Craig Stevens was involved. And so I called Craig and I said, do you have any idea that I have exactly the equipment that you have selected across the street? There was a long pause in the conversation. And then he said to me, Norm, I am so deeply sorry. I was not aware of the fact that you had that equipment across the street. He said, I was aware of the fact that you had facilities in Ocala and west to the Gulf. I had no earthly idea that you had a physical presence in the villages. Now, it is a credit to the Robert Boy Snow Oncology Institute that the staff at the Moffitt actually selected the exact same equipment that we presently have in our facility now as their wish list. As to the PET CT scanner, we have used that state-of-the-art equipment for years, and we have a seamless direct computer link into our treatment planning system, so that when a patient obtains a PET CT scan with Lake Imaging, that data is immediately fed into our computer system so that we can have that data to design patients' treatments. We never saw a need to duplicate such equipment, but rather to use the excellent resources and personnel that are already available. Does everyone know what a PET CT scan is? Do you want me to just do I have time to just take a minute to explain to you what a PET CT is? It is not a piece of therapy. It is a diagnostic tool. When you get a PET CT scan, they inject into your arm radioactively labeled sugar. And that sugar travels around your body and is deposited in those structures that use sugar. Now, for those of us who have a brain which uses a lot of sugar, when that study is done, your brain will turn on like a light bulb in that picture. And if you have a heart, and the heart uses sugar as a fuel for the muscle, the heart will show up. And then the excess sugar gets dumped into your kidneys and collects in your bladder, and those structures on every one of us will appear bright, because it's normal anatomy that's taking place. But what we're looking for is the use of sugar in areas that shouldn't be using sugar. And cancer cells use a lot of sugar. And depending on how actively they're using that sugar, we assign it a number. It's called an SUV, standardized uptake value. Normal tissue has an SUV of 1 to 1.5. If you have inflammation in that area of your body, it may be 2 or 3. But when you get up around 6 or more, we know there's a problem. And it is a beautiful way to pick up early disease in areas of your body that other tests may never show us. And I've had patients that have had values as high as 35 in those areas. It has become a valuable tool. It is not part of therapy. And we saw very little sense in duplicating a piece of diagnostic equipment at a cost of $1.5 million to residents. Well, in essence, the conversation that I had with Dr. Stevens was, he informed me he was never aware of the duplication that occurred.